I would like to remind everyone that our models are dependent on strict social distancing. And what we are seeing is still new transmission happening in our community. So we are committed to ensuring that we are in lockstep with our state leaders at the government level and in our state health department. And we continue to communicate regularly with them about what we're seeing here in Cuyahoga County on the front lines. But we cannot let off. What we're seeing now is often what happened 2 to 14 days ago. And so we have to recognize that unless we stop transmission that's still happening, we're going to continue to need to address this in a very robust way. This is a long-term proposition for all of us. This is a marathon, not a sprint. And given the continued transmission, we need people to wear masks. We need people to socially distance. We need people to not have parties. We need people to not have gatherings. We need people to work remotely whenever possible. And so we will continue to work with our state leaders around what we're seeing on the ground. But the message for our community today is that we can't let up, and we'll continue to see what happens over the next few weeks. But I'm articulating to you today that I'm still seeing transmission, our team still sees transmission, and our team still sees people who are ill.
It's hard to set a date on these things. For me, what's particularly important is that we understand that we have to continue to, we're going to need to develop a lot of guidance that is around a range of ways that we interact. And CDC and the State Health Department and the Cuyahoga County Health Department working very closely with the Emergency Operations Center that Executive Budish has stood up for the community, working very closely with them. We have been developing guidance and will continue to do that. We need to be creative about how we understand the safest way to conduct business. And so we will follow the governor's playbook and Dr. Acton's playbook. It has served us well. But going forward, there are several things I think people need to consider. One is that we expect more testing to become available here in the coming weeks and months. And as we seek, we will find there will be more cases. More testing means more cases, and we need to understand that. So a lot of our numbers, all the numbers are tied to testing. We can only know where we test. And so we also have heard Dr. Fauci say that up to 50% of people may not have symptoms and can transmit, being asymptomatic. So we need to understand that. The testing is critical for us to identify and reduce risk and the potential for more cases. The testing is critical to identify potential risk and to prevent future cases. And we all have to lead by example. It was great to see members of the media wearing masks because people will be watching you on TV and in your communities, as leaders in your families and in your places of work. And for me, that's leadership. And so we all have that responsibility to lead by example, to follow the guidance that will emerge as we're creative in assuring that we reduce the risk going forward in the community, even as we begin to address the disruptions and start to address bringing society back to some sense of normalcy. But it's about protecting the public's health, our collective health. And in that regard, all of us are public health workers in our families, in our neighborhoods, and in our businesses. And that's a good thing, that we recognize how critical it is to the health of all of our friends and family. And at the end of the day, good health is tied to the opportunity to work, to be productive, to give back to society, those that volunteer. And that's the heartblood of Greater Cleveland and what we do here. And so follow the guidance and lead in your communities as the guidance emerges to try and reduce risk. Because reducing risk reduces fatalities in the future. And all of us have an interest in doing everything we can to protect the Greater Clevelanders.
We've had an internal group working to make sure that the county itself, as a government, will be ready when we are advised to reopen. We have seen changes in the county government operations and throughout the business community and the general community, which I think those changes will continue. It will be a different world going forward. We have learned that a lot of work can be done remotely and can be done efficiently and effectively, and we will continue those efforts in the new era of post-coronavirus. We have been out there aggressively pursuing protective equipment for people, including the people in the nursing homes that you mentioned, and we will continue to do that, because just because business and the community starts to reopen doesn't mean we're not going to still have to follow the advice that we've been preaching for weeks, and that is the hand washing, the social distancing, and making sure that you wear the masks and other protective equipment. We will be in a much better position going forward than we were at the beginning of this crisis, because nobody anticipated it, and unfortunately the strategic stockpile was not sufficient to provide the protective equipment people needed throughout the county. So we will be ready, both internally and for the community, when we are advised by the medical experts that it can be done safely.